A very warm welcome to another exciting edition of your favorite program, Health Affair on AIT. On the program, we'll focus on critical public health challenges, issues of women and children with a view to finding lasting solutions. My name is Oshuomo Daniels, your host. On the program today, we'll be focusing on fibroids, a critical health challenge that has claimed many lives of young women in Nigeria. We'll set the ball rolling right after the news segment. Please don't go away. In Lagos State, malaria accounts for more than 70% of outpatients in the public health facilities, with an annual record of about 700,000 cases. The topography and ecological features of Lagos State, the vast coastal terrain, and the poor drainages, according to the state government, are major predisposing factors that contribute to transmission of malaria all year round. In line with the 2021 World Malaria Day theme, Zero Malaria, Draw the Line Against Malaria, the state government is calling for collective responsibility by all stakeholders in reducing the scourge of malaria. Such actions include promotion of long-lasting insecticidal net utilization, prompt diagnosis in public health facilities using rapid test kits, awareness and sensitization activities to promote integrated and continued measures. 25th of April every year, World Malaria Day is commemorated to create massive awareness on the global burden of malaria and to mobilize support for the rollback malaria strategies. Sheun Ayodeji is 27 years old. She got involved in a motorcycle accident in 2017 that resulted in the amputation of her right leg.
My leg got cut off immediately at the scene of the accident. I have a prosthetic leg. It helps me move. Even if in the house I hop, and there are times I actually have pain.
Cases of limb loss are on the increase in Nigeria, and most of them are due to congenital defect, mismanaged fractures, complications arising from traditional bone setting, diabetes, and lots more. According to some parents who have had the experience with their children, the limbs are meant to be replaced within 4 to 6 months at a cost that ranges from 200,000 to $1 million plus. This situation is causing a lot of frustration for affected families, coupled with the stigmatization.
Most of it can be very frustrating for a parent when all of a sudden, maybe you have planned that your child will use this leg for maybe 9 months, then under 6 months you have to change it. So that. The second thing is the availability of the components in the country. They are imported. We don't manufacture here in Nigeria. So that's one place I want to call the government in, because we need to start manufacturing, we need to start equipping, And then the third frustration for me is the stigmatization and discrimination that goes with it. And again, where I call in the government to come in and ensure enforcement and implementation of the law that has been put in place. You still have schools that reject children that have been amputated.
The month of April every year is set aside as Limb Loss Awareness Month, an occasion that provides opportunity for more enlightenment about the condition.
A large percentage of Lagos residents have gone back to their old ways of life, ignoring the use of the nose mask and other preventive measures against the coronavirus. Many have also refused to take the vaccine for reasons not unconnected with their safety.
I'm not interested. I'm okay. With God, I'm okay.
It's for what now? I don't have coronavirus. You know that the thing is good for them, they can use it, but not for me, not my family.
This situation, Professor Yuwale Tomori and other experts say portends danger.
We're still having big parties and all that kind of thing. So that the virus did not behave like in Europe. That's what the luck we have.
Risk communication, community engagement. If you do that properly, then more people will understand why they should not abandon wearing of masks and washing of hands and social distancing.
Following the different conspiracy theories concerning the choice of AstraZeneca vaccine for Nigeria, the experts expatiated on this.
It is not the day you get the vaccine that you develop immunity, which means between the first week or two, if you are exposed to the virus, you can still get infected. And then the first dose sometimes doesn't give you all the immunity you require. So you need a second booster.
The science that has developed the vaccine is worldwide. When you say they want to kill some set of people, will they want to kill the whole world? No. The media in its own space has to come up with communication of education of how to make people understand that the risk in not taking is more than the risk in not in taking.
As at the time of this report, Nigeria had recorded over 164,000 total confirmed cases of COVID-19 and over 2,000 deaths. I met this young girl recently in Alimosho, an area in Lagos State where sex and gender-based violence has become endemic. At 18, she was impregnated by a boyfriend and now left with a 10-month-old baby to care for.
If I do any single mistake for him, he just beats me like that. Just started beating me. We have already pursued the 2 of us away. So the only thing that I need is only help.
Beyond the risk of a bleak future, many young girls through rape or sexual exploitation have contracted diseases and some even lost their lives.
Some are not conscious of what they are doing. When they have taken in their hands and all sort of things that can boost, their sexual what have you. This also is also another factor.
Some people believe that, okay, once you are married and you are being abused in your relationship, you shouldn't stop. You should continue in that relationship because your bride price has been paid. Some men believe that once they pay a woman's bride price, they have bought her. So they have the power to do anything they want to her.
Some people who have also identified indecent dressing as a major problem challenge parents to wake up to their responsibility.
Some of them identify indecent dressing as a factor to sexual and gender-based violence. They identify economic status, that sometimes because the women are poor, men tend to override them, control them, and then leave them. They also identify issues of broken homes, upbringing.
There's this picture I saw on Facebook. A little girl was having a birthday, and then the mother wore bikini for her and pants, and then did makeup, fixed lashes for the little girl, snapped her and posted it. So people were, though it's obvious she's a baby mama, people were telling her that, but this way you dress your child, what if she grows up and she's like, people should leave my child alone, I'm the one, and we're in the modern age. That kind of girl, when she grows up, wearing bikini, wearing bob shorts, wearing singlets will become a normal thing for her.
Whenever we see any issue that has to do with child abuse, domestic violence, we should take action. We should report as well. We should not just keep it to ourselves. For us, not to have reoccurrence of the issues we are having in the community any longer.
From forced and early marriages, sexual assault, mental to physical abuse, Nigeria has continued to witness an upsurge in cases of gender-based violence, a trend that rose sharply with the COVID-19 pandemic lockdown in year 2020.
Welcome back. Fibroids are abnormal growths that develop in a woman's uterus, causing severe abdominal pain and most times heavy bleeding. Fibroids are non-cancerous tumors, with cause still unknown. However, some risk factors, including family history, obesity, and early onset of puberty, have been identified by some health experts. In Nigeria, more than 100,000 cases are recorded annually, and a lot of Nigerian women have died due to complications from fibroid operations. I spoke with a Nigerian doctor with over 50 years of experience in fibroid operation, Dr. Gabriel Akilo. Dr. Akilo is trained abroad and has carried out several fibroid operations successfully.
We call them fibromyomata in clinical parlance. Fibroids, in layman's language, are growth from the womb of a woman. When a lady is born, the womb very small size. As the lady grows in age, the womb grows bigger. But comes to a time that after about age 20, 30, 25, they start growing these fibroids. The tumors, what causes fibroid? That's $1 million question. I always say whoever knows the cause of fibroid will win a Nobel Prize. Up to tomorrow, nobody knows the cause. Why are some growing it and some are not growing it? We don't know. The only two things we know about fibroids, number one, when a woman is getting pregnant frequently, she's protected from having fibroids, so to say. She's not likely to have fibroids. On the other hand, we say the womb, that empty womb, the dormant womb grows something. The life does not allow for what do you call it? So something must grow there. The dormant womb has to grow something. So when the womb, a woman is not getting pregnant regularly, then they tend to grow fibroids. So those are the two things we know about fibroids. Age, that is, if the woman marries early and then she starts getting pregnant, then they are not likely to grow fibroids. On the other hand, when they are waiting to finish school at university and so the age of 30 something before they get married, many of them would have grown fibroids. But it pays to obey God's law, like I always say. It's unfortunate because many of my patients will say, oh God, I preserve myself for a while, you pay me back. I said, don't worry. The other ones too are wasting their time. It's not the best to them. But the truth is, for those who marry late, they have a higher chance of growing fibroids. If you have 100 women who are not married, who have not had children by the age of 35, 35% of them will have fibroids, 1 in 3. On the other hand, 100 women who are married or having children, maybe only 5% of them. They can still grow, but only very few of them. It has nothing to do with race. When I was in England, we had fibroids, and we operated them. There is this free treatment, so anytime that once it's about this size of a grape before it gets big, they remove it. Not like the giant ones that we see here, size of 40 weeks pregnancy. It's very rampant here, it's very common, and it grows, and then people don't pay attention to it. So,
what are the factors to look out for?
Factors to look out for,
Symptoms, I mean.
Yes, usually many of them have no symptoms. They just keep growing and growing and growing to a big size until the woman knows that her tummy is getting big. So they may not show any symptoms. There are three types of fibroids. We have those that we call subserous. Those are outside the womb itself, not inside the womb. Then the wall of the womb itself, that's intramural. And then we have those that are submucous. That is those that are inside the womb itself. The ones inside the womb cause heavy bleeding. The woman can start bleeding 12 days, heavy flow. Some of them cannot use pad, they use cloth. So that's one of the symptoms, menorrhagia, heavy bleeding. But most of them, I said, if they are not inside the womb, then they may not manifest. And many of them, we catch them during the infertility period when they are not getting pregnant. The fibroid is preventing them from getting pregnant. And then, of course, some of them will cause pain. We call it red degeneration. The blood supply is increased, so they have pain, severe pain, and then we can detect it. Of course, some of them get pregnant, and we have red degeneration in pregnancy. That is, the fibroids get very painful, and that's how they present.
You said that while abroad, they have operated on many patients with fibroid. How many of them survived it, and then why do you think more people die with it here?
If you go to good centers in Nigeria, patients are not likely to die. We will say that we've gone a long way. 1982, when I came back from England, there are very few of us who are gynecologists. Most of the operations were done by doctors who are not gynecologists, and everywhere, so that will account for the mortality, and we've heard of so many cases like that. But in good hands with experts, gynecologists or expert surgeons, those who are experienced in it, mortality is very, very low. Mortality is very low nowadays. But that's when done by the right people at the right places. But when done by quacks or those who are not experienced in it, then they run into trouble. What I always say is that experience is very important. When you are experienced in fibroid operation, then you are not likely to have problems. You know what to do, and when there are challenges, you know how to tackle them. They tell all sorts of stories, and you hear all horrific things happen. Some women, they put hot iron into their vagina to shrink fibroids. Some of them, they give all these concoctions to drink, and some of them will vomit and stool and die from the complications of those things. The best solution to fibroids is surgery, especially when they are causing symptoms. There are certain drugs that we know, medical, that can shrink it, and they shrink it, and after 3 months of shrinking it, if you stop the drugs, they grow back. So when a woman is getting too old, like 40, 45, and she doesn't want to, then we can give them those kind of injections. But otherwise, when they are growing big at a young age, for a woman who wants to have a baby, removing the fibroid by surgery, by experienced doctor, is the best. If people come to hospital in time, don't wait for them to get very big. Those ones that are very big can also be removed. We do joint approach. We call specialists to join us, and we do them together. We put heads together. But ordinarily, fibroids are safe to remove, and then you will not die if you go to the right place, to the right doctor, who is especially those who are gynecologists, who know their onions and who know what to do, and then they face challenges, and then there's no problem. Like I said, one who has removed 1,000 fibroids cannot be frightened. Then people say the eyes that have seen the mighty ocean cannot be afraid of the small the lagoon. So those of us who have removed big ones, 99%, and those giant ones, then there's nothing that can frighten us. But like I said, when you see the challenging one, you know what to do. Finance is a problem, because the bigger the fibroid, the more costly they will be, and some of them cannot afford it, so they keep waiting, and the fibroids keep growing.
How do we solve that problem of finance?
That's why we come to the government again. If government can say this PPP, they can encourage that somebody can go to a big hospital, and then they help them, encourage them, help them to finance it. Government can finance it for them, and so contribute, and then give them some money to go and do it. The big hospital, the public hospitals cannot do all of them, because when I was in Lagos State in the late 80s, I used to have about 200 people on my waiting list for fibroids alone, because they were so common, and then there were very few of us gynecologists then. Well, we are more now, and there are many health centers, but still, you go to the general hospitals, some of them are on waiting list for 1 year, up to now. So, because there are quite many, and then Nigeria is 180 million people, and there are so many women who are of this age, and they are growing fibroids, so the government cannot cope. And the government hospitals cannot cope. So there are so many. So government may help. Like I said, if you have those on your waiting list, you can distribute them among the gynecologists, and government can pay part of it. The ones that kill most are the ones that bleed most. They are the submucous. Those ones inside the womb itself. I have a woman now that I saw this last 2 weeks ago, and the blood level was 4 grams, hemoglobin of 4. If we want to operate her, we need to bring the blood level to 10. She requires about 6-7 pints of blood, because she bleeds heavily, almost. She cannot use ordinary sanitary towel. She has to use cloth. And then many of them that are bleeding like that. The intramural too can also cause it. As it grows bigger, it presses on the cavity, and then can cause, but majorly, the submucous ones are the ones that cause heavy bleeding, and they are the ones that can kill. And some women have bled to death. They bleed continuously, 15 days, every month, and the blood level keeps reducing until they go into heart failure.
Thanks for coming on the show. We appreciate you.
Thank you very much.
On our nutrition segment, we preach the gospel of eating right to stay healthy. The focus today is on pawpaw.
Pawpaw, also called papaya, are large oval-shaped greenish fleshy fruits that are grown in many parts of the world. They have a mellow taste and are greenish when unripe, with a hard pulp, and yellowish amber or orange when fully ripe, with a very soft flesh. Pawpaw plants grow in 3 sexes: male, female, and hermaphrodite. The male produces only pollen with no fruits. The female produces small fruits when pollinated. The hermaphrodite can self-pollinate, since its flowers contain both male stamens and female ovaries. Almost all commercial pawpaw orchards contain only hermaphrodites. It is widely cultivated throughout the world, especially in tropical countries of the world, but its origin is in the tropics of the Americas, from northern South America through the Central America to southern Mexico. Because it is widely grown in many countries of the world, it is very popular and has diverse uses in many cultures. All parts of pawpaw tree, the seeds, the bark of the tree, the leaves and fruits are edible and are used in one way or the other. In traditional medicine, pawpaw leaves are used as treatment for malaria, as a purgative, and also used to relieve asthma. It is also used in many cuisines all over the world. The unripe green fruits can be eaten when cooked, but the ripe fruits is usually eaten raw. The black seeds of pawpaw are also edible, and they have a sharp, spicy taste. Green pawpaw is used in Southeast Asian cooking, both raw and cooked. In some parts of Asia, the young leaves of pawpaw are steamed and eaten like spinach. It is also very popular among the Filipinos, Indonesians, Brazilians, and Americans. In 2018, global production of pawpaw was 13.3 million tons, led by India with 45% of the world total. Global production of pawpaw grew significantly over the early 21st century, mainly as a result of increased production in India and demands by the United States. Raw pawpaw pulp contains 88% of water and also rich in carbohydrates and vitamin C. A 100-gram serving of raw pawpaw contains energy, 43 kilocalories, water, 88 grams, carbohydrates, 10.82 grams, sugars, 7.82 grams, dietary fiber, 1.7 grams, fats, 0.26 gram, protein, 0.47 gram, vitamin C, 67 milligram, 75% of daily value. Vitamin B9, 38 microgram, 10% of daily value. Potassium, 182 milligram, 4% of daily value. Magnesium, 21 milligram, 6% of daily value. Calcium, 20 milligram, 2% of daily value. Iron, 0.25 milligram, 2% of daily value. Manganese, 0.04 milligram, 2% of daily value. And lycopene, 1,828 microgram. Pawpaw skin, pulp, and seeds contain a variety of phytochemicals, including carotenoids and polyphenols, which are a dietary source of antioxidants that can reduce inflammation, fight diseases, protect against skin damage, improve heart health, improve digestion, and help keep you looking young.
On Health Affair, we'll give you a holistic approach to health education and information. So come with me to our clinic.
Infertility is a major issue in a country like Nigeria, and all over the world. Fertility is an issue. We know that it affects about 1 in 6 couples at some point in their lifetime. The couple should be investigated together. That's both the man and the woman. So, and it's not a question of blame. Sometimes these things happen not because of what somebody has done, but just, but the most important thing is to be aware that, for infertility, there are treatment options. There are effective treatment options. And, the couple just need to access the right facilities. And it's not all about IVF. You don't need IVF for every case of infertility. There are some cases that, lifestyle changes, personal advices, drugs, or some operative procedures will suffice.
On our perception segment, we give a voice to your opinion on the way forward for the nation's health sector.
Healthcare delivery system of the country appears to be dangling in mid-air. And as far as we are concerned, it could drop and explode beyond repair any day, except something is done and done urgently. Anywhere in the world, the economy, the success or failure of any nation is in the private sector. Taking a cue from that, the health system is also in the private sector. But this private sector for the first time in our history, we want to bring together. Let us establish a blueprint, a document, a communique for Nigeria. That communique at the end of the day will be delivered to the National Assembly and to the federal government of Nigeria.
Welcome to our Know Your Instrument segment, an aspect of the program that focuses on first aid and the benefits of different medical instruments.
Methylated spirit refers to alcohol for general use that has been made unfit for drinking by the addition of 10% methanol and sometimes violet dye. Methylated spirit is commonly used in hospitals to sterilize medical equipment, to clean wounds, and lots more. This is where we draw the curtain on the show today. Please join us same time next week for another exciting edition of the program. I remain your host, Ushuomowa Daniels. Remember that your health is the greatest asset you require to achieve all other things. Please pay attention to it.